guys, welcome to Plastic Surgery Education. So today I want to discuss something about choosing your plastic surgeon. So once you have decided that you want to undergo a plastic surgery procedure, how do you go ahead and choose the best or the appropriate plastic surgeon for your condition? So a couple of points I would like to make here. First of all, see to it that you don't go to a quack. You have actually chosen a plastic surgeon. So how do you do that? You ask the surgeon whether you are a qualified plastic surgeon, whether you have completed your general surgery and your MCH plastic surgery or DNB plastic surgery course after 3 years of general surgery. So that would clarify things. Other ways of finding that out is, for example, I am based in Maharashtra. It's a state in India. So we have something called Maharashtra Medical Council. So if you put in my name in the Maharashtra Medical Council online doctor search registry, or if you put in my registration number there, it will show you my qualifications. You can verify whether I am a plastic surgeon or not. So that is one way of doing it. I believe this is possible across all states in India and across the globe, whichever country you are in. There is always a provision that you can verify the authenticity, the qualifications of your plastic surgeon, or for that matter, qualification of any surgeon of any specialty. Then there are associations. Now in India, we have Association of Plastic Surgeons of India. It has got a dedicated website. So you can check the name of your plastic surgeon on their website and ascertain whether he is a member of the association. Generally, all the plastic surgeons in India are members of the Association of Plastic Surgeons of India. So that is one way of identifying it. Similarly, if you are in different countries, your plastic surgeons in those countries are members of associations of those respective countries, so you can easily ascertain their qualification. Now once you know that you are actually dealing with a plastic surgeon, the next thing is I would suggest is identify a high volume center. Now as we all know, as the number of volumes go up, the experience goes up, the competence of the surgeon also improves with doing more and more number of cases of the same type. Now, plastic surgery is a huge subject, has got various subspecialties. Generally, what comes to the mind of patients is cosmetic surgeries. But apart from that, a plastic surgeon also does onco reconstruction, that is post-malignancy reconstruction. He does trauma, he or she does hand surgeries, and a variety of other surgeries. So, depending upon what surgery you are intending to do, you need to identify a high volume center for that particular surgery. So my personal experience says that high volume centers always have better outcomes as compared to low volume centers of that particular set. If I would like to give an example, now Tata Memorial Hospital, as we all know, is a very high volume center for cancer surgeries. So obviously they have got a lot of experience dealing with cancers and cancer surgeries. So the outcomes are better. Similarly, you need to identify high volume centers for whatever indication you are planning to have a cosmetic surgery. Having said that, you need to also ascertain the experience of your surgeon as a high volume surgeon for that particular surgery. Now, once you have identified your plastic surgeon, the next thing is you obviously want to discuss. I would suggest writing down your questions so that you save time, you save your time, you save the time of your plastic surgeon. You write down what all you want to ask to your plastic surgeon, and that makes the conversation easier and simpler. So you would want to know the experience of the plastic surgeon, as well as you would like to see the clinical photographs. So most of the plastic surgeons have a set of clinical photographs whom they tend to show to the patients, so that the patients can have an idea as to how the before and after looks. It is also important to note here that many patients do not prefer that their photographs are shared with other patients. So that is one way wherein a plastic surgeon would be very reluctant to show or to share clinical photographs of the previous operated cases. But having said that, obviously we do tend to have a set of patients who are always willing to share their experiences. So ask for pre-op and post-op photographs of conditions where the patients have been operated. Also, you would like to talk to the patients individually who have been operated regarding how was their experience, how was the post-op course of the disease, what was the healing time. So not many patients actually agree to share their experiences with other patients. But yes, if there are certain patients who are willing, your plastic surgeon can guide you, can give you their contact details, and then you can have a word-to-word conversation, a face-to-face conversation with those patients. Then what about Google reviews? I personally would take Google reviews with a pinch of salt. Not all patients are happy with their plastic surgeons. Similarly, there are fake reviews as well. So there might be dissatisfied patients who keep on posting poor reviews for a particular surgeon. So I would say take Google reviews with a pinch of salt. The best recommendations for any plastic surgeon, or for that matter any surgeon of any specialty, comes from patients. So if you individually know a certain patient who has undergone a certain procedure which you would like to undergo, and he has recommended a plastic surgeon to you, you should surely go ahead and take an opinion. So on social media, there are certain groups, say for example, clefts or rhinoplasties. So there are groups of these patients where if you have a patient in a particular area where you are staying in, that patient might be able to suggest you a plastic surgeon based on his or her own experience. Then one of the important things which you should consider while selecting a plastic surgeon is the distance. So the area where you are staying and area where the plastic surgeon is located. Now in plastic surgery, there are certain procedures which sort of don't require repeated follow-ups. A single visit, maybe two visits. Say for example, Botox. If you have to take a Botox from a plastic surgeon, you go to the OPD, you have a Botox and the matter ends. Complication rates are minimal. You don't need to go there frequently. But apart from that, if you have to consult your plastic surgeon, or there are certain procedures which require longer follow-ups, which require more frequent follow-ups. For example, a tissue expander. A tissue expander needs repeated visits to the plastic surgeon. If there are reconstructive procedures involving nerves, staged procedures, again repeated follow-up is needed. So in that case, it is not wise that you identify a center or a plastic surgeon which is far off, possibly in some other district, and follow-up visits become difficult. In those cases, it is better to identify a plastic surgeon which is near your place of stay, and that makes follow-up easier. More follow-up means better attention of the plastic surgeon and better outcomes. So distance is one thing which should not be neglected when you select a plastic surgeon. Coming to complications, you should always ask your plastic surgeon about the potential complications of the procedure which you are planning to undergo. I personally feel, and I feel this very strongly, that if your plastic surgeon says that he has never had a complication in doing this procedure, either he is not a plastic surgeon, or he doesn't do plastic surgeries, or he is lying. Complications are inevitable part of any surgery. If a surgeon or a plastic surgeon is doing those procedures, there are bound to be complications, and as patients, even you should be willing to admit it that any surgery has got its own inherent risks. Complications are a part of surgical procedures, and complications are going to be there. You don't want to identify a surgeon who has never had a complication. You would want a surgeon who has had complications and who has that experience to manage those complications. So this is one thing which I think you should discuss with your plastic surgeon about what are the complications of the procedure, and if at all complications occur, how are we going to manage them together as a team. Apart from that, you need to have a second opinion. Any surgical procedure, I firmly believe that a second opinion is a must before you go in for any surgical procedure. Even go for a third opinion. Have a genuine conversation with your plastic surgeon and see how your frequencies match, see how your queries are addressed to, and then take a call. Always better you have a second opinion, you have a third opinion, and then take a call regarding which plastic surgeon do you want to finalize for your surgery. Now, one final point, a lot of companies have cropped up wherein they provide you a very cheap sort of consultation, or rather free consultation. But many times what happens is, in these platforms, online platforms which have come up, the actual surgeon who is going to perform your surgery is totally different from the one who is going to consult you. And more often than not, these consulting people, they are not plastic surgeons. They probably are not even surgeons. They are just technicians. So I would be very reluctant with these procedures. The best way is consult a plastic surgeon who is going to operate on you, or who is going to be a part of the team who is going to operate on you. So I think these were some of the quick tips which I thought I should discuss regarding how you choose your plastic surgeon. So that's all for now, guys. Stay tuned. Cheers. Take care.